Hi everyone, today we're going to talk to you about the Head and Neck Cancer Supportive Care and Survivorship Program.
Hi everyone, my name is Allie Hunter and I am one of the North Carolina Albert Schweitzer Fellows from the Duke University School of Medicine. Head and neck cancers are a group of cancers of the upper aerodigestive tract. What does that mean? It's cancers of the lips, the mouth, the tongue, the back of the throat, and the voice box.
Now we'll hear from our other project fellow discussing our overview.
Hi, I'm Rebecca Zasloff. I'm a third-year medical student at Duke, and I'm one of the Schweitzer Fellows. So the first part of our project is to develop a patient support group for head and neck cancer patients through the Duke Cancer Institute.
The Head and Neck Cancer Support Group occurs on the second Monday of every month from 4 to 5 p.m.
The second part of our project has to do with a student-based patient navigation program. A lot of patients with head and neck cancer experience some side effects that are related to their treatment, whether that's physical, like dry mouth or difficulty swallowing, or also some mental health side effects as well, such as depression and anxiety. And so a lot of times after treatment, patients are not able to get some of that supportive care needs that are met. We designed an intervention that's student-based, where we connect patients with medical students who will offer monthly check-ins with patients who are in the survivorship portion of their cancer journey and screen for any existing social needs or unmet supportive care needs and connect them with resources that exist through the Duke Cancer Institute.
Now we'll hear from one of the patient survivors of head and neck cancer.
When you speak with another cancer patient, you already have a guarantee that they kind of know what's going on, and you won't have to do a whole lot of explaining, because it can be very difficult to not experience something like a critical illness, because people that care about me, they're doing the best they can. I find that support groups are really helpful.
Now we're going to hear from our mentor, Dr. Osazua Peters.
My name is Nosa Osazua Peters, Associate Professor in the Department of Head and Neck Surgery and Communication Sciences. I'm really glad that we're doing this. Over 10 years ago, I had an opportunity to give a talk to a group of head and neck cancer survivors. A patient walked up to me and said, "Doc, do you know how it feels when every food, anything you eat tastes like cardboard?" And then the other guy came to me and said, "Every night I go to bed, I just wish I don't wake up." And then pointing over his left shoulders, he said, "If not for her, I would have been long gone. I just know it, I just know it, I just know it." And being in that room in that moment was just such a huge aha moment for me.
Now we'll hear from Jeffrey about his experience with the program.
I'm Jeffrey Vaughn, and I am a medical family therapist at the Cancer Institute, the Duke's Cancer Institute, and provide individual and couples and family therapies, and also facilitate support groups. And one of the support groups that we have started recently is the Head and Neck Cancer Support Group. And what I have quickly learned is this is a population with very specific needs. Each group we've had, I would say, 6 to 9 people attend, mostly patients and survivors, but also some caregivers. And it gives them the opportunity to really share in a safe and confidential space what they've been through, what they're continuing to go through, some years out of treatment, and how they manage all those stressors. What we have found so far in the group is that we, the facilitators, actually have to do very little because there's so much shared experience. It's just a great place for them to come together and share what they've been through.
To increase awareness for our group, we were featured on the March cover of the Cancer Care Calendar from the Duke Cancer Institute. Through our new program associated with the Duke Cancer Institute and the Albert Schweitzer Fellowship, we're hopeful to improve and provide holistic, comprehensive care for patients with head and neck cancer.
I actually believe that cancer care is not complete without a group like this, where people who are bonded together because of a shared etiology like this can come into a safe space to talk about the things that they're struggling with in the presence of clinical providers and the investigative team.
Thank you so much to the Duke University School of Medicine, the North Carolina chapter of the Albert Schweitzer Fellowship, and the Duke Cancer Institute for supporting this project.